Okay, everyone. So we know that having gut issues really sucks. So this IBS Awareness Month, we are here to bring you a range of dietary and non-dietary strategies to help you manage your gut symptoms better. Hello, my name is Alana. I'm the founder of A Little Bit Yummy, and I'm going to be your host today. And joining me is Emily Clark, a registered dietitian from the Monash FODMAP team. Hello, Emily.
Hi, Alana, and welcome everyone. It's great to be here today for IBS Awareness Month.
Thank you so much for joining us. So obviously when you have gut symptoms, you don't want to be tied to the toilet all the time. You want to find those strategies that are going to work for you. So my first question for you today is, if you have just been diagnosed with irritable bowel syndrome by your doctor, what should you think about first when thinking about your diet and food?
Yeah, great question. Look, it's really, really important to firstly work with a dietitian. So a dietitian is someone who is an expert in providing individualized nutrition advice. So they can have a look at your diet, and it might be something as simple as looking at whether you're getting enough water, whether you're getting enough fiber, are you getting enough exercise, are you eating a good variety of healthy foods, and those sorts of things. Because for some people, that might be some small changes that you need to make. And for other people, it might be that you work closely with the dietitian in starting the low FODMAP diet and working with the symptoms like that. So it's really, really important to check in with a healthcare professional, someone like a dietitian, and make sure you are getting the right advice and make sure that it's individualized, because no two people are the same. So we can't just do a one size fits all and we've worked out your IBS symptoms. It's unfortunately a little bit more work than that.
Absolutely. IBS is so complex and everyone's IBS journey looks completely different. Like what works for me is not necessarily going to work for you. So you really want to be looking at those small dietary changes you can make first before diving into something a lot more complex like the FODMAP diet. So checking in with that dietitian is a great idea. So obviously today for those of you who haven't joined a FODMAP chat session before, I'm just going to explain that we cover the FODMAP diet in so much depth. We've got like getting started videos and a whole lot of tip videos already recorded for you, which you can go and find. So we're not going to jump into the FODMAP diet in depth today because there's so many other strategies that you can also be using to manage those IBS symptoms. So this session today is going to focus on those other strategies. So Emily, my next question for you is, if you've started looking at those dietary changes and you need more strategies to help, what should you think about when you're saying maybe eating your meals or sitting down for your meals? Are there specific strategies you can use at those times to reduce symptoms?
Yeah, definitely. Look, in this day and age, we're all quite guilty of living a very fast-paced sort of lifestyle. So a lot of people will find that they're eating on the go or eating a lot of takeout, or maybe even when they come home in the evenings, they whip up a quick meal and sit down in front of the TV. And more often than not, we're not actually paying attention to what we're eating. So as I said, we're all guilty of it, but it's just something that we need to actually think about. So for example, if you're having your meal, you actually need to sit down and practice mindfulness while you're eating. Actually look at what you've prepared, actually taste it, chew the food, be there while you're actually eating the meal. And it actually sort of helps with that part of digestion as well, because it's a whole process that begins with sort of looking at the food and smelling the food is that first phase of digestion. That's when you start to produce your enzymes and things like that. So it's important to be there in that moment. And it's really important to practice that mindful eating. A lot of the time people will eat in the car, or as I said, eating in front of the TV. It's quick, it's efficient, you're multitasking. But how often do you eat something while you're doing that? And then you think later and you go, oh, how was that? Did I actually enjoy that? I can't really remember.
Do they even chew that food, or do they just inhale it while doing something else? Yeah.
Yeah, exactly. And again, part of digestion is actually chewing the food. So breaking that food down from that physical aspect is still part of the digestive process. So it's important to include that as well. So just small changes like that, that little bit of mindfulness can have a big impact on how you're feeling as well. And food is wonderful. It's so enjoyable. We should take that time to enjoy it too. That's what I think anyway.
Yeah, no, I agree with you there as well. And I think it's another thing to remember is that if you're sitting in front of the TV or your laptop and you're wolfing down the meal, often you're not listening to those hunger cues either. And so your body might be like, hello, I'm actually good now. You can slow down. I'm ready just to digest this bit. And so you end up overeating, and that can also lead to more pressure on your digestive system too.
Absolutely.
Now, Emily, I do have a quick question for you. I know a lot of people gulp and guzzle from their drink bottles on the go. I know a lot of people use breath mints or chewing gum because they can't have a meal or they just want to freshen up. Do things like that also impact your gut symptoms?
Look, it can have an impact. So a lot of the time, discomfort from IBS comes from the buildup of gas that you have in your gastrointestinal tract. And if you're sipping from a straw, having carbonated drinks, or even, chewing gum and those sorts of things, that's extra air that you're actually swallowing, and it's got to come out one end. So for a lot of people, that can add some extra symptoms for them. And even things like breath mints or chewing gums, they try to make them sugar-free because it's good for your dental health. But a lot of the time that means they have those sugar alcohols, those polyols, that a lot of the time cause symptoms in people with IBS, and even the general population as well. So they come with a warning label: excessive consumption may have a laxative effect. They're really high in sorbitol or other artificial sweeteners. So absolutely, having one of those instead of a meal will still give you symptoms a lot of the time. So you've really got to pick your battles there, and bear that in mind, that if you're someone that is quite sensitive to those polyols, that maybe not the best idea for you as well.
Great tips. Thank you for that. So we've just covered off like some dietary changes and some eating habits that you want to be mindful of. So obviously managing IBS doesn't just evolve around the food that you're having. There's also other lifestyle factors that can have an impact. So we're going to do a quick explore of those factors now. So the first one we've got on our list is gut-based hypnotherapy for IBS. Is this a good idea, and how does this work?
Yeah, it's a great question. And obviously I'm a dietitian, so I know a lot about food, and only a little bit about sort of the psychology of those sorts of things. So really important to work with a psychologist that specializes in that area. But as part of Monash, we have done some research with some of those psychologists in the area of the gut-directed hypnotherapy. And the evidence is quite promising. So they have found relief in about 70 to 80% of people, sort of similar to that of the low FODMAP diet. So it can be quite a good alternative for people if they maybe didn't have success with the diet, or they find it's a bit too restrictive and not quite as easy for them long-term to follow. So the idea behind the gut-directed hypnotherapy is that you work one-on-one with that the psychologist, and what they try and do is tap into that subconscious and try and help you sort of manage the symptoms and have a bit more control over that. So for example, if you think of the medication, what they try and do is work with you to imagine that medication actually having that physical impact, and it's that extra layer of control and management of symptoms that way. And so some people find that really helpful as well, and it's definitely worth tapping into if, as I said, the FODMAP diet's not quite for you as well.
Absolutely. If you think about your brain and your gut, there's kind of like a superhighway that runs between your brain and all the nerves that goes in your gut. So I guess that gut-based hypnotherapy and the strategies that the psychologist can give you can sort of help you reprogram how those two are working together. So it's a really fascinating area, and it'll be really cool to see whether the science develops in that space over the coming years. But if you're struggling, definitely worth looking into. Okay, next on our list is stress and anxiety management. Do you have any tools that you'd like to recommend to your patients or clients as they go through the FODMAP process, or if they're struggling with their IBS symptoms?
Look, stress and anxiety is different for everyone, and everyone has different coping mechanisms. So again, it's always best to work with a professional, or even like your group of friends who know you best, and like work out what is best for you. Some general tips and advice might be increasing the amount of exercise that you're doing. So whether it be making sure you're going for a walk or a light run or something 4 to 5 times a week, something like that, so that you have a physical outlet. Really good for those endorphins, heart health, all of those sorts of things. It could be something like practicing mindfulness or yoga. A lot of people find that that helps them get back in tune with their physical and mental self, and really help with that stress and anxiety as well. Or it could be something as simple as having a really good nighttime routine, whether it's having a hot bath or a hot shower, sitting down and having a hot cup of tea or a peppermint tea if you're having bad symptoms, something like that. There's lots of different ways that people manage their stress, and it doesn't have to be expensive or excessive. It can just be those simple things that you can include in your routine, and always making sure that you have friends or family that you're checking in with as well, because having those conversations can take the weight off your shoulders as well. So they're all just little things that sometimes we forget to do, and it's part of the self-care that we need to put into ourselves.
There's some great strategies there, and investing even just a minute or two on self-care a day can make a massive difference to how you feel overall.
Definitely.
So we're getting through our list of additional strategies here. And before you mentioned exercise as being beneficial, are there different types of exercise that are better, and can high intensity exercise actually worsen IBS symptoms?
That is a great question. And look, there is some emerging evidence as well around this area. So generally speaking, if you're exercising maybe half an hour or an hour a day, that tends to increase your health outcomes. So it can help with stress management, it's good for general fitness, and it may help if you're having some IBS related symptoms. We do tend to see that endurance or ultra endurance athletes experience more IBS related symptoms. A lot of the time it's just isolated to when they are exercising. It's not necessarily a long-term thing. It's more an exercise-induced IBS. But these tend to be in the populations where they're exercising for, 4 or 6 hours a day minimum, which generally speaking isn't everyone. They're those elite athletes that we all aspire to be. So for those individuals, definitely working with a dietitian is important to make sure that they are managing those symptoms. So we have found that even just a low FODMAP diet for the 24 hours beforehand sort of may have a good impact for them, or making sure that the gels or the bars that they're having during exercise is lower in FODMAP to reduce those symptoms. So that's sort of that one end. But for the general population, some exercise is actually better than no exercise. And I guess one thing that we have seen, if we were to isolate a specific exercise, is that running, especially in really high heat, so over 30 degrees Celsius, is probably where we see those IBS related symptoms coming into play there. So something to be mindful of if you're an athlete is watching your training methods. Are you training sort of in the morning where it's a bit cooler, making sure you're hydrated? Those sorts of things are really important as well to be mindful of.
And for the rest of us, just find something you enjoy and get your body moving, because moving helps the gut, moving helps the mind, and moving helps our overall health.
Definitely. Even if it's walking, yoga, those sorts of things, or if you're into going to the gym or running or, martial arts, whatever it is, anything's better than nothing always.
Awesome. Okay, and so our final question for this quick FODMAP chat session is, are there any medications or other strategies that you'd like to talk about today that can help manage those IBS symptoms?
Yeah, look, there's a whole range of things that you can buy when you walk into a pharmacy or supermarket, so it can be quite overwhelming. I would say the first place to start is checking in with your GP or healthcare practitioner, really important to make sure you're getting something that's right for you. But starting with the basics, we can always try peppermint oil or peppermint capsules. They can be good to help with bloating and gas and things like that. If you're not getting enough fiber in your diet, because the low FODMAP diet can be quite low in fiber, there are fiber supplements out there that we've tested, certified. They can help improve your fiber intake, which can help improve your sort of regularity of your gastrointestinal tract as well. And of course, you can always go down the other end, which there are prescription medications that can help with IBS-related symptoms as well. So checking with the GP, it could be some antispasmodics that sort of help with that physical sensation. It could be there are some antidepressants that have been shown to help as well. If you're someone that might be the right avenue to go down as well, you can always check in with your GP. So lots of different things that you can do, but always worth checking in with a GP or healthcare practitioner to make sure you're choosing the right one for you as well.
Great advice there, Emily. Thank you for that. And just remember that you're not alone on this journey. There are many, many people out there going through IBS and learning to manage their symptoms. And it's okay to ask for more help if you are struggling. So please go and talk to your GP if you feel like you need a bit more support, because there are other options out there for you. So thank you so much for joining us today, Emily. You've been a wealth of information, and hopefully people have taken away a few extra strategies that they might want to consider or think about as they go through their irritable bowel syndrome journey.
It's been lovely chatting with you, Alana, as always. And yes, you can always reach out to us as well in the Monash FODMAP team if there's anything in particular that you need extra help with. Our inquiry line is there to help answer any questions you might have too. And make sure you check the app as well. Lots of information in there if you need that extra support on the go.
Awesome. Thank you for mentioning that. So if you would like to support Monash University further, make sure you go and download the Monash University A FODMAP Diet app, which is available through the Apple App Store or the Google Play Store. Any money you spend on that app goes straight back into FODMAP research and goes back into helping the IBS community. So by buying that, you're not only helping yourself, but you're also helping your community too. And if you need more low FODMAP support, then make sure you go and check out monashfodmap.com. There's some amazing resources on there. And then we also have more resources at alittlebit.yummy.com. Okay, everyone, thank you so much for joining us. Emily, thank you again for sharing your knowledge with us today. We look forward to catching you in our next FODMAP chat session.
Sounds good. Thanks, everyone.